Never is never right. Always is always wrong. We will not be doing justice to the patient. It's a death sentence. At times I fear for myself that am I becoming too insensitive? Yes, I am becoming insensitive.
What breast cancer is and its treatment.
There are certain cancers which are totally curable.
Most doctors in India, at least in my experience, I don't know about yours, but they don't take too kindly to questions saying what are the symptoms that you need to look out for.
Lumps in or nodes in the root of the neck or in the just above the collarbone. There is a controlled biopsy, which means we do not incise the tumor. Without a biopsy, we cannot move forward. The final goal of all these tests is to 32 women per 100,000 Indian women have breast cancer.
There are so many questions coming up, all that you have wished to ask a doctor, but you could not.
So the commonest symptom is...
Hi. So I don't know if many of you are aware that I had breast cancer. It's been 2 years since my treatment, and here I am, alive, kicking, and absolutely fine. So today with me to talk to you is none other than my own oncologist, Dr. Gaurav Agarwal.
Hello.
So Dr. Gaurav Agarwal is head of endocrine and breast surgery at SGPGI Lucknow. He has been past president of Breast Surgery International, and this is absolutely amazing. He is among the top 2% of scientists in the world as far as breast cancer is concerned. And this is as per research in the Stanford University. So here is Dr. Gaurav Agarwal to talk to you about breast cancer, and listen very, very carefully because you won't get this chance. So Dr. Agarwal, would you now summarize in 2 minutes first what breast cancer is and its treatment?
Okay. So, well, breast cancer is a dreaded disease, but it starts as a tiny, painless lump in breast of a woman. If not treated in time, it can progress to larger size and has the property to or capability to spread to other body parts, and so it can be fatal. It can result in premature death of some women if not treated sufficiently early. It's the commonest cancer in women across the globe, as also in India. As I said, painless lump is the commonest symptom with which this is detected. Any woman with a painless lump or any other symptom which may mimic breast cancer, usually the doctors would undertake some tests, including a mammography, which is kind of a specialized X-ray of the breast, and then conduct a biopsy, a needle biopsy, with which one can confirm whether the lump is that of a cancer or otherwise. It is treated by a combination of various types of treatments, surgery being the mainstay of it, especially in the early stages. And then to augment or further strengthen the outcomes or improve the outcomes with surgery, appropriate combination of radiation therapy, chemotherapy, hormone treatment, biological treatment are all done. If detected in stages 1 and 2, which means in stages where the cancer has not yet spread to any parts outside the breast and the armpit, we can cure majority of women with this kind of treatment. And what must be said today is treatment itself is not discomforting or problematic, because we can conserve the breast of majority of women in stages 1 and 2. One does not need to undergo a mutilating surgery of removal of whole of the breast, and we now often employ a technique what we call as oncoplastic breast surgery, using which we are able to cure the disease while also ensuring that the shape of the breast, symmetry of the breasts, and the overall body shape and contour is not disturbed. So breast cancer is indeed curable. Unfortunately, in India, still quite a few women are diagnosed with advanced stage cancers, primarily because of ignorance and perhaps also because they're afraid of treatment. Even in advanced stage disease, it is eminently treatable. We cannot assure cure to all of them, but about 50% of patients can still be cured. So that's breast cancer for you.
Yeah, great. So I've prepared a whole list of questions for him so that I don't miss anything at all, so that you don't miss anything at all. So, as a cancer surgeon, this I've been really waiting to ask you because, when I was undergoing treatment, I saw the number of people that were there in PGI. It's a government hospital. And you can imagine that the number of patients that are there and that he has to see. So, you are a human being. And you see this women suffering in different stages of suffering every single day, and almost every single day of your life. How do you take this? How do you cope with this?
Oh, I think this is kind of a learning process. Uh, when I see a woman in pain, somebody suffering because of the disease, the first natural reaction in my mind is, how can I help? And if the intention is that to help someone, I have to make myself or keep myself in a state of mind that I will be able to take level headed, correct decisions for them. So, certainly, as human beings, all of us are moved, are troubled with the agony of people around you. But equally, I have to keep myself in a sane, stable state of mind to be able to think rightly, correctly, and make correct decisions for them.
So, did you learn along the way? I mean, did you feel like this, say, 10 years ago? Or is it only
Absolutely.
now that you feel that you are very, pragmatic and you have to tackle cases? Is it only now, or
Well, I would
right from the
say
start?
yes, this is a process which is evolving. I am evolving with experience. As you said, it is today I am able to make some pragmatic, practical decisions for them. When I started some 30 years ago, perhaps I would have been more emotional and more moved by. So at times I fear for myself that am I becoming too insensitive? But then when I think about it, it dawns on me that yes, I am becoming insensitive, but then the reason why I am being so is for the betterment of my patients. And this is not unique to me. This is something which all doctors who are thinking in terms of betterment of their patients, helping their patients, have to be. This is kind of a professional necessity for us.
Right. So, while on the subject of doctors, I have to say this. Um, Most doctors in India, at least in my experience, I don't know about yours, but they don't take too kindly to questions. A patient comes in great distress and he or she really wants to ask so many things, but they are always dismissed. And, but here I would say that he has been one doctor who has actually answered. I was amazed. I would fearfully ask, okay, do you think I can do this? And he would answer. And, I got bolder with my questions and he would answer every single time. So here it is again, many questions for you. So just you wait. There are so many questions coming up, all that you have wished to ask a doctor, but you could not. So here it is.
Oh, thank you very much. You're being
Yeah.
so kind to me.
Yeah.
But I must say that a teacher of mine has kind of driven this message home in my mind. Never is never right, always is always wrong. So I hope I answer majority of questions posed to
Yeah, I
me.
think I think the younger doctors should really learn, and they can when they see an example like yourself and other doctors who are very empathetic to patients and patient and answer patiently. So I think the younger people, you're a teacher, and I'm sure all your students will learn the same too. So which is wonderful.
I hope
So
too.
yeah, sorry. Okay. So, you have already explained what breast cancer is in simple terms. Now, another question. How old has your youngest patient been?
sadly very young. In I can recollect one who was just 15.
15?
But let's not scare people
No.
with these anecdotes and these is exceptional or rarest of rare cases. By and large, breast cancer starts at around in 40s and 50s. But in India, there are many women with in their late 20s, early 30s who have breast cancer. Our data, SGPGI hospital registry data, suggests that close to 40% of all our patients are younger than 40 years age.
My goodness, I see.
Yes, that's very different compared to Western world, but very similar to all Indian institutions, Indian registries. So yes, some of my patients have been very young. Fortunately, those constitute, I would say, not even 2% of. I mean, if I count women who have been less than 25 years age, they are very few.
Okay.
But sadly, cancer at such a young age is never easy for the patient to handle, for the family to accept, and for the doctors to treat. This is
Yeah.
a worst possible combination physically, mentally, psychologically, and from the biological viewpoint too. The breast cancer at young age is more aggressive compared to breast
Is that
cancer
right?
in
I see.
elderlies.
Oh,
Yeah.
I see. Gosh. And, I've often wondered, even when I had breast cancer, I had, of course, some maybe genetic factors because my mama's daughters had breast cancer, etc. So, in your experience, are there factors that can give you cancer?
Yes, we know one thing that, as you perhaps were hinting, there are families with number of members who have cancers, including breast cancers. I'm sure our viewers have all heard about the story of Angelina Jolie, the famous Hollywood actress. And similar families do exist in our country too. In our own experience, close to about 5% of all breast cancers that we treat, they have familial breast cancers. They cancers run in their families. There are certain identifiable gene mutations, genetic defects that we can find on doing certain tests. But then the proportion of women with breast cancer and those who have identifiable genetic mutations is very low, very small. But other than the genetic factors, there are other predisposing factors, which I mean, I'll have to explain this just to make sure that our viewers do not get too scared of these predisposing factors or risk factors. These are certain facts about your life, either internal or external, which make you more at risk for developing breast cancer. An example: not bearing any children, not breastfeeding any children. This is a risk
Oh, is
factor.
that right?
Yes.
Oh, I see.
Nature has perhaps, I mean, the primary reason why women have breasts very different from men is to breastfeed a newborn. That's the natural reason of the breast being there. If the breast have not functioned by way of feeding a child or feeding a newborn, and that's like a dysfunctional breast, and that perhaps puts a whole cycle of dysfunction in the breast, causing numerous illnesses, including breast cancer.
So, childbearing as well.
Yes. So the statistic says, the data suggests that women who have born minimum of 2 children and have breastfed them for about at least 6 months, they are at much lesser risk of developing breast cancer compared to women who have born no children or who have not breastfed any children. But then I must repeat, this is only a predisposing or a risk factor. It's not as if somebody has not born any children,
Yeah.
would certainly have a breast cancer. And let me explain this a little better. If you are driving a motor car on the road, there's a possibility that you may meet with an accident. Sitting in my living room, I will not be at risk of meeting a similar accident. But that doesn't mean that every time I venture out on the road, in my car, I will indeed meet with an accident. Similarly, women who have not born children and who have certain other risk factors, they are at a higher risk of developing cancer. But that certainly doesn't mean that all of them would have breast cancer.
Right.
It is only a risk factor.
Yeah. But incidentally, let me tell you all, I mean, this goes not just for women. It is not women who should be sitting and listening really to this podcast. It should be men as well. Because, you know, there are women in your families all around you. And if one person has cancer, believe me, everybody else is involved. And which brings me to this. Do men have breast cancer as well?
Yes. Breast cancer is equally possible, or it happens to men as well. But the statistics again tells us that if there are 100 patients of breast cancer, 99 of them are women, only one is a man. It's quite understandable, not just from the viewpoint of volume of breast tissue, but also the functionality of breast tissue. Breast in men is like a rudimentary organ. I mean, it doesn't have a function. To the contrary, a female breast is a fully functional organ. It has functional cells which are replicating or growing and dying, and new cells being formed. And as a result, tumors and cancers are certainly more probable in female breast. So yes, it can occur to men, but at a much lesser possibility.
So we just spoke about Angelina Jolie. You brought her up. And, you know, I know that I read that she had mastectomy. I mean, it was a preemptive sort of a thing because she didn't want any case of breast because she had it in her family and she underwent that. But you, I think, have a slightly different opinion on that. Whether it's mastectomy, which is good, meaning removal of the breast completely if you have cancer, or whether it is lumpectomy, that you remove the lump and then, you know, have reconstructive surgery. So which, according to you, is a better option?
Okay, so there are two different perspectives or context in which we should be discussing this whole issue. One is, how do we treat a woman who has a manifest breast cancer? The cancer has already formed, and how do we treat it? And the second is, how do we manage or we prevent cancer from occurring in a woman who is genetically predisposed to developing breast cancer? And that is what was the case with Angelina Jolie. Her mother, her grandmother, both had breast cancers. She tested for that BRCA mutations and she was positive. And even before she developed any tumors or cancers, she underwent what we call double mastectomy or prophylactic or risk-reducing mastectomy, where the entire breast tissue underneath the skin and the nipple is removed and it is replaced by a prosthesis, an artificial breast, kind of a plastic surgery. Thus, the probability of cancer occurring to her has been reduced by more than 99%.
Oh, is that right?
Yes. So even before cancer can form,
Yes.
it is the cancer, the potentially cancer-bearing cells are all taken out. She further undertook another operation for removal of the ovaries and the tubes, salpingo-oophorectomy. Women who have this gene mutation, BRCA mutation, they are not only at risk of developing breast cancers, they can also develop ovarian cancer or cancer of the salpingo or of the tubes, fallopian tubes. So before any cancer can form there, after a woman has completed her family, we remove surgically the tubes and the ovaries, thus reducing the risk of ovarian cancer too. And that has a bearing on the probability of future development of breast cancer as well. And that has a physiological basis. After all, breast cancers are driven by female sex hormones, estrogen and progesterone. So if we are reducing or removing the source of these female sex hormones, we can reduce the probability of progression of breast cancer too.
Right. What about, say, in my case, there was already a lump in the breast. So what happens then?
Yes. So now Majority of women like you have a breast cancer and no identifiable gene mutation, which is the cause for this tumor. But a minority of them have a BRCA mutation or other gene mutations, which we can put to as the reason, the root cause of the breast cancer developing. So, for all such women who do not have a genetic gene mutation or genetic cause for cancer, we call them sporadic breast cancers. The ideal treatment is to remove the tumor along with some normal breast tissue all around to ensure that there is no remnant breast cancer tissue or no remnant breast cancer cells in the breast, what we call as negative margins, and then treat the rest of the breast with radiation. This is a process what we call as breast conservation treatment. Breast conservation treatment is better compared to removal of whole of the breast, an operation which is usually called mastectomy, because firstly, the current data suggests that women who have undergone breast conservation, they have better probability of survival, long-term survival for even after treatment, compared to women who had to undergo mastectomy.
Oh, is it?
Yes. And then the other reason is equally important. No sane human being would be happy losing a body organ. And removal of a breast is such a psychological trauma to a woman. Women, it's a common knowledge that breasts are kind of indicators or signs of femininity.
Yeah,
So,
but then, I mean, you have to weigh the, consequences, I imagine. So if you were to say that, okay, I think you need your breast removed, I would go ahead and do so because that is in my interest. So, but you still say that that is still not advisable.
okay,
If you remove this factor that, it's a sign of whatever, femininity, beauty, whatever, if you put that aside, would you still say that, you should still have the breast?
okay. So I think what we are both talking about is a common factor. If there is an absolute necessity for getting rid of a body part to preserve life, we will have to
Right.
take that step. We'll have to make that compromise and accept it. But if I know that conserving the breast, I can achieve better, if not, I mean,
Worse.
for sure, I'm not compromising on the chances of cure, preserving or conserving the breast. Why should I advise any woman to remove the breast completely? Of course, I must also mention here that not every patient with breast cancer is suitable for breast conservation. In our own experience, close to about 70% or so women that we treat are candidates. They can be offered breast conservation, whereas 30% still require complete removal of the breast. In certain Western countries, the kind of stage at which majority of breast cancer are detected, more than 90% of women are candidates for breast conservation. And in our
Oh,
own
is it?
country,
I see.
we treat the kind of patients relatively better educated, well to do sections of the society. But if you move to certain rural or suburban centers, you will find we have to unfortunately advise mastectomy or complete removal of breast to more than 50% of women. So it also depends on the specific need of an individual patient based on the stage of the disease. If the disease is picked up early, we can conserve the breast. If the disease is picked up in locally advanced or third stage cancers, unfortunately, for a majority of the patients in this stage, we have to advocate complete removal of the
Right.
breast.
So, you have to detect breast cancer early. Now, even in my case, I don't know. I used to do this breast examination. You're supposed to examine yourself every other day, every week. But then, the breast feels lumpy anyway. And, I missed it. So my cancer got caught only because I happened to visit a gynecologist. It was just a matter of chance. So How do you suggest that our viewers, they examine themselves and to detect it? How should they detect their cancer?
Okay. So, whatever is important to us in life, we cannot rely only on one thing. We have to have multiple checks to ensure that we do not miss that critical or important thing. For detecting breast cancer early, the first step is awareness. I mean, the reason we are talking together today primarily is to create awareness in the society that breast cancer is a common cancer. It can occur to just about every woman,
Anybody, yeah,
anybody. Nobody is immune.
right.
And then what are the common symptoms? I hope we'll be talking about those a little later. Second part is, as part of being aware, if every woman beyond 25, 20 years age starts breast self examination, examines her own breast once every month systematically, and then if she finds anything amiss, any new lump, another symptom, any change in the breast which cannot be explained by herself, goes to a doctor, gets it checked. One can detect the breast cancer much earlier than if you are ignorant about it. The next step, which is equally important, is beyond 40 years age, we advocate or we advise every woman should undergo an annual health checkup, as part of which the doctor would examine her breasts and perhaps undertake what we call screening mammography. Mammography, as we talked earlier, is a specialized X ray of the breast which can see deep into the breast. Often, this is done along with ultrasound of the breast, or in younger age, we often use ultrasound more compared to
So, after
mammography.
what age should you go for mammography? Because I know, yeah, at an earlier stage they advise ultrasound.
Yes, so beyond 40 years age, usually we would advise screening mammography.
Okay.
So this is to be done once every year, but often if we find that the risk of breast cancer in a particular woman is not so high, and for 2 consecutive years we have not found anything suspicious, we can reduce the frequency of the screening mammograms from once every year to once every 2 years. So that
Okay.
is what should be done by every woman to detect breast cancer early.
Right. And as you were just saying, what are the symptoms that you need to look out for?
So the commonest symptom is a painless lump, usually in beyond 35, 40 years age, which is constant. It doesn't come and go. Breast lumps are very common. Almost every woman at some stage in her life would have faced or felt a breast lump or pain in the breast. Pain, by the way, is not a common symptom of breast cancer. So, uh, these lumps, which are constant, painless, are certainly cannot be ignored. Unfortunately, nobody, not even the most experienced doctor, can just examine a lady and be absolutely certain about whether the disease is, whether the lump is of cancer or otherwise. So doctors have to undertake some tests, including biopsy, before one can ascertain whether it is a cancer or otherwise. Other symptoms of breast cancer can be change in the shape and size of the breast. Some bit of asymmetry in the breast is natural. Almost every woman has a slight asymmetry, but everybody is aware of what is her shape, her body shape, her breast shape, and symmetry. If after a certain age, all of a sudden there's a asymmetry which emerges, one breast starts looking larger compared to the other. Changes in the breast skin or the nipple, indrawing of the nipple, excoriation on the nipple or surrounding area in the skin, or a dimple, a new dimpling of skin on the breast, appearance like orange peel, thickening of the skin which is looking a little reddish compared to rest of the skin of the breast. These are the symptoms. uh, Lumps or nodes in the armpit, are also symptoms which can be reflective of breast cancer, and so can be lumps in or nodes in the root of the neck or in the just above the collarbone. And then, if in case the cancer has been there for a while, it has spread to other body parts, then depending on which body part is affected, bones are commonly the sites to which the breast cancer spreads. If a woman has spread of cancer to the bones, she may have pain in the bones. She may also have fractures with trivial trauma or minor impacts. So these are some of the symptoms of breast cancer.
Right, right. And it's really, really odd because when I was undergoing treatment, please have your tea, get cold. There was this young woman, I remember she must have been 35, in mid 30s, and she had come with her father she was in the initial stages of treatment. And when I asked her, I said, "Kaise aapko pata chala?" She said, "हमें ये पता तो चल गया था करीब 5-6 महीना पहले, लेकिन घर में कुछ कुछ काम होता रहता है और हम उसे इग्नोर करते चले, हमको जैसे लग रहा था कि नहीं ये नहीं होगा, पर ये था ब्रेस्ट कैंसर." हमने इन अ स्ट्रेंज वे what she was saying was it was like a mental block. 6 महीना शायद उसने इग्नोर किया इसको, और तो तब तक मैं कह रही थी कि वो हमारे सामने बढ़ा है, द लम्प. She knew it. And so it happens this way also, that you are very busy in your life, you're running around too much and you ignore certain factors. Maybe you've seen a change. So this can be extremely damaging. And I also find हमारे साथ भी हुआ था that you avoid going to the hospital, the doctor. चलो अभी नहीं, चले जाएंगे 2-3 महीने बाद, और हमने उस बात को छोड़ दी. That can also be really, it can cost you your life. So if you ever feel anything, I mean, my daughter always says, if there's anything, she says, no, let's go to the doctor. And I think you should do that. It's better to be cautious, I feel. So that this sort of thing doesn't happen. Now, yes, the word cancer, when I had cancer, when I had announced it on Instagram, many of you know, and people said, whenever they would ask me a question, they would say, "Oh, you've got the big C. You have a big sickness." Nobody would call it cancer. Because of this, they probably felt, I don't know, it's just like a big monster. But it's actually not so. And there are certain misconceptions that people have, regarding cancer. So, what are, say, 2 misconceptions that should not be there?
I think the first big misconception is something that you already have hinted to. This misconception that it's a death sentence.
It's
a death sentence.
Yeah.
It is certainly not. There are patients, I mean, we are only right now talking mostly about breast cancer, but if we can expand this discussion to cancers of all body parts or all body organs, there are certain cancers which are totally curable.
Certain cancers meaning breast.
Or not just breast.
Yeah.
I mean, for example, thyroid cancer, majority of them are curable. With some treatment, we can cure them and be very sure about achieving cure.
I see.
To the contrary, there are other cancers which are much more aggressive, and howsoever aggressively we may try to treat them, we can still not cure them. So now let's talk about breast cancer. As I talked earlier, early stage breast cancers are eminently curable. If we detect breast cancer in first stage, which means the tumor size is less than 2 centimeter and it hasn't spread to any other parts, with appropriate treatment, we can cure more than 95% women.
You're right. There is this idea that a biopsy नहीं करनी चाहिए.
Yes, that's
क्योंकि उससे फैल जाएगा, कैंसर फैल जाएगा, सर्जरी नहीं करनी चाहिए, फैल जाएगा कैंसर. So, what do you have to say about that?
Oh, that's an absolute myth. This is not true at all. I do have a theory why this kind of a myth exists in the society. In earlier times, perhaps even now, in certain cases, many tumors and cancers are treated by quacks. People who have no or very little idea about how to treat cancers. These traditional healers or all quacks, they have a belief that every lump is a rasoli or an abscess.
Oh.
And such abscesses have to be drained. They have to be incised and drained. If it is done to a cancerous lump, it will certainly lead to a number of problems. It will bleed a
I
lot.
see. Yeah.
It can be very painful. It will certainly not heal, and the disease would progress and spread. So it's in that scenario that this myth has emerged. What we do as modern medicine doctors and every knowledgeable doctor is a controlled biopsy, which means we do not incise the tumor. In a controlled way, we take out some cells or a small fragment of tissue from the core of the tumor. And that's what biopsy is. And then we do not just leave the patient and tumor alone. It is almost certainly followed by appropriate treatment. So there is absolutely no truth in this notion that a biopsy would cause progression or spread of disease. Had this been so, almost every day a few 100,000 women undergo breast biopsies across the globe. If this was true, all of them would be dying. To the contrary, this is the most crucial initial step in diagnosis. Without a biopsy, we cannot move forward. Without the biopsy and the information that the biopsy brings to us, we will not be able to plan treatment for majority of women.
Yeah. Also, while on the case of cancer in the breast itself, can it happen in the axilla under the arm? Can there be a lump there that could be also considered breast cancer, or is it just the breast?
Okay, so some of our viewers may not be aware, but the human breast, it extends into the armpit. So there's a kind of an extension. We call it axillary tail, kind of a tail which goes into the armpit, and it has similar breast tissue as rest of the breast. And so hypothetically, a tumor can arise in the axillary tail too. But more often than not, the lumps or nodes that you feel or one can find in the armpit is actually a spread of a cancer from cancer within the breast to the armpit nodes.
Oh, I see.
So that's the axillary nodes or armpit nodes are the first place to which breast cancer spreads to. We know it, and that is why assessment of breast cancer patients invariably or as a rule involves assessment of the armpits, and surgery of breast cancer patient also invariably involves surgery on the armpit too.
Yeah.
So I do not remember, but did you undergo sentinel lymph node biopsy along with your breast cancer surgery?
I did.
Yes.
And also, I think when you did the surgery, you harvested something like 18 lymph nodes, I think.
Correct. Yes.
So it was all over from under the armpits, and it becomes totally numb. It takes a long time.
Yeah.
But of course, again, that's the least of the problems.
I know.
So I think you have to do that too, right?
Yes. So now, if I take a step back and talk about treatment or the philosophy of cancer treatment today, we believe in personalized medicine and evidence-based. These are certain phrases that I'm sure many women, many people have heard about. Perhaps they may be wondering what these are. Personalized medicine is so important, so relevant, pertinent to our way of treating patients today. It's like one size cannot fit all. We have to select the right treatment for an individual patient based on certain facts about her own lifestyle, her own facts of life, whether she is premenopausal, postmenopausal, what is her age, her stage of the disease, whether it is early stage, advanced stage, locally advanced, third stage, and then the biology. what kind of cells, how aggressively growing and multiplying cells the cancer has, or is it indolent disease? So various factors put together help us arrive at a treatment plan, individualized treatment plan for an individual patient. That's personalized medicine.
Right.
How do we do this,
Yeah.
or how we treat an individual patient is all dictated by certain guidelines. These guidelines are prepared by international and national professional societies based on scientific evidence, and that is how I say
see.
that we practice evidence-based medicine. If
Okay.
I advise somebody to undertake a certain treatment, it is not only because I feel or I believe it will work. I have to have scientific proof or evidence to back this advice that it certainly would help, it would work. I should also be aware what are the adverse effects of treatment, and all that is part of evidence based medicine.
I see.
So, uh, you ask me about how do we decide on a specific treatment for an individual patient. These are the various factors which go into deciding a patient's treatment plan.
Right. But does that mean that the treatment, say you prescribed for me, I can't remember, 12 paclitaxels and 21 trastuzumabs. Do you think I would have received the same treatment, say, if I was in Chennai or if I was in Mumbai? Would the doctor there the doctor would have recommended the same treatment as you?
Quite certainly, yes.
I see.
Again, see, all well-trained surgical oncologists, breast surgeons, medical and radiation oncologists who have expertise in treating breast cancers and with some bit of experience, they all peruse the similar or same kind of resources of information. We all have our own textbooks and reference books and research articles and then guidelines to follow. And irrespective whether I'm practicing in Boston or Bombay or in Pittsburgh
Lucknow,
or
yeah.
Patna or Lucknow or London, we pretty much use the same stuff.
Oh, I see. Okay.
So, had you been treated in Bombay or Mumbai, almost certainly you would have been advised the same treatment. There may be minor difference in say sequence of treatment, number of cycles of treatment, duration of treatment, perhaps, but by and large it is the same.
Right. Okay. Now, while on treatments, I remember asking you that, I needed a PET scan because that is what everybody tells you first. Go have a PET scan done because then that detects cancer and things like that. But then you recommended otherwise. You said, no, we don't need a PET scan. We'll just treat you with what reports we have. Why is that?
Okay. So again, it's part of the same individualized or personalized medicine practice. We are dictated by this information we already have, based on which we decide what is the next step. So it is advised that patients who have stages 1 or 2 cancers and no symptoms which may be attributable to spread of cancer outside the breast and armpit, they need not have to undergo PET scan. It becomes an unnecessary step, and not only it adds to the cost and complexity or inconvenience of treatment, it can also potentially add to unnecessary further testing. Why? PET scan is a kind of a scan which picks up any disease anywhere in the body, not necessarily just cancers.
I see.
So, and in our own country, with the kind of caseload or burden of tuberculosis and certain other infections and certain other inflammatory diseases, all those two are picked up by a PET scan.
So they come out as the same kind of, with the same color and,
Very
as
similar. So
they look
there
similar. Oh, I
there
see.
are ways by using which nuclear medicine physicians and we oncologists, we try to discern between something which is because of cancer and otherwise, but these are not foolproof. So if let's take a hypothetical case. a woman who's 60 and who has a stage 1 breast cancer, based on whatever examination I've done, ask for a PET scan, and I do one, and there's a spot picked up in the chest, in the lungs, or in between lungs, so what we call as mediastinum. The next logical step will have to be a biopsy of that. Biopsy of a lesion in the mediastinum is a major undertaking.
I see.
And doing that has never been shown to have any consequence in terms of outcomes of this woman or this patient. So if I do this unnecessary PET scan, I might put the patient on a wild goose chase, and in the process delay the actual treatment, delay the treatment of breast cancer, increase the cost of treatment, increase the inconvenience for no good reason, no benefit to the patient. So we select patients who would benefit from a PET scan, or for that matter any additional evaluation, any additional strategy in workup or evaluation or treatment.
I see.
So to the contrary, let's now talk of a patient, a woman who has been diagnosed with stage 3 cancer. The probability that this woman may have cancer spread to other body parts is close to 1/3, 33%. So even
What,
in
30%?
33%, 1/3 of these women
I see.
potentially have cancer spread to other body part, which
I
is so far silent. We do not know. In stage 1, this probability is less than 2%. And stage 2 is close to 5%, or even less than 5%. So that is why all guidelines, they suggest that in stages 1 and 2, we should not undertake
I see.
PET scans and other tests to evaluate for systemic metastasis or spread of cancer to other body parts.
Okay.
In stage 3, it's a different scenario,
Right.
because the probability of finding a spread is higher. That is why we do it. Or else, even with stage 1, if there's a symptom which might suggest a spread of cancer to bones or to liver or lung or whichever other body part, then we undertake these tests.
Right.
And then finally, I may be repeating myself, the final goal of all these tests is to ensure adequate, appropriate, timely treatment of the patient to achieve the optimal outcomes, the best possible outcome for the patient. If we start investigating or over investigating, we would only harm the interest of the patient and not help her.
Right. Now, just one other thing I need to, there are actually 101 things I want to ask you, but I think shortage of time. So I just need to ask you, does a positive, for a person who has cancer, does a positive, or let's say a person who doesn't have cancer, a normal person, does the kind of food you eat, does that help? Does the exercise you do outside, does that help or not, in
Absolutely.
your experience?
Oh, in my own experience and in experience of all oncologists, all of these are helpful. Every positive step that you take helps you achieve better results with the treatment. So let's take two scenarios. Similar stage, similar kind of women, with one who has depression, who has negative thoughts, who who thinks that she'll never be cured,
Right.
undergoing similar treatment. The other woman with a good family support, upbeat, eager to take on the disease and defeat it. So, in a way, positive mindset.
Yes.
The outcomes are different. The reasons
Really?
are
Yeah.
a woman who is depressed in a negative state of mind has negative chemicals going on in her body.
Is that a thing?
It is a thing. It is indeed a scientifically proven fact.
I see.
After all, I mean, let's forget cancer and breast cancer for a moment. Isn't it true? In every walk of life, a positively inclined person has much better success in life compared to somebody who's a negative one. And it's all because of what it does to your mind, to your mindset. So it does help. Secondly, you asked about exercise,
And
perhaps,
food.
and food.
Yeah.
So exercise, yoga, meditation, all these factors, they bring positive pheromones, hormones in your body. And they have a positive impact on the health, state of health, general health,
Right.
not necessarily of the cancer itself. So, by the way, whenever we are treating a patient with a cancer, we are treating the patient and not just the cancer. What good it would be to cure the tumor but make the patient pathetic. So, unless we treat the patient as a wholesome human being and take care of each aspect of the human body and not just the tumor or cancer itself, we will not be doing justice to the patient. So, all these different things that we talked about, exercise, yoga, meditation, and then nutritious, healthy food, all these have an impact on both the psychological aspects of that person, psyche of the person, as well as outcomes of the disease.
Yeah.
In certain way, this is something which I often tell my patients. Cancer treatment in form of surgery, chemotherapy, radiotherapy, etc., is the actual meal that you are having. Let's say you have dal as a staple diet. So this is the dal. If you add a bit of salt to this diet, to the dal, and some spices, it makes it more palatable and to some extent enjoyable. Similarly, if you add yoga, meditation, good food, nutrition, adequate nutrition to the cancer treatment, that's like spice to this dal,
Right.
and it works better.
Yeah. So having said that, people in the cities versus people who live in the villages, with all the pollution, atmospheric pollution, with adulteration of food, with the kind, there's a lot of talk of, chicken, for instance, being injected with antibiotics and hormones. So, people in the cities are consuming all of this. Whereas people in the villages, maybe the atmosphere is much better. There's less pollution. They are eating purer food. And in your experience, have you found the instance of cancer less in people in the villages versus people in the cities? I mean, don't take into the fact that, people might be more poor, too poor to even come and report the cancer. So if you kind of ignore that, what would you say?
Okay, I may have said it earlier that I am dictated by scientific evidence
Right.
more than anything else.
Yes.
And the evidence that we have from cancer registries, these are registries run by the Indian Council of Medical Research, for example, which collect data and tell us what is the status in cities, in suburban areas, and then in villages. So certainly there's a stark difference in cancer incidence as also of breast cancer between urban areas and rural areas. There's a huge difference. Like in our own country, Chandigarh, South Mumbai, certain northeastern states have much higher incidence of breast cancer compared to places like Chhattisgarh or Jharkhand and so many other places.
But it's not because they are going unreported.
It's not because of that. It may be partly because of it, or in a minor way, underreporting may be contributing to it. But these cancer registries, they have an active data collection system. So they would go home to home, collect data about how many women have what diseases or what proportion of population has which disease. So unlikely that this will be because of underreporting. So they have targets to undertake survey of a certain population and then find out the actual data.
Right.
So maybe there would be some different standards or some different reach of this reporting, but equally there are true factors. And then this is not unique to India. I mean, African countries, certain African countries have much lower incidence of breast cancer compared to so many other countries. Some of the highest incidence of breast cancer incidence is reported from Scandinavian countries, North America, Australia, the industrialized countries. So the difference.
Where do we stand in India compared to the world in the instance of breast cancer?
Oh,
Percentage.
percentage wise, or our incidence, we talk about how many women out of every 100,000 living women have breast cancer. That is the kind of incidence we talk about. So, Indian ballpark figure is about 32. 32 women per 100,000 Indian women have breast cancer.
32 women out of
Every 100,000 women,
100,000.
but this is annual incidence. So
Right.
every year, 32 new breast cancer out of every 100,000 Indian women are detected.
Okay.
In comparison, this figure is 120, 130 and beyond in these westernized countries.
Okay, so I think we can go on and on about this, but I think if you have 2 minutes to summarize all that we discussed, you have exactly 2 minutes to summarize this whole subject of cancer, which is so easy.
Okay, we are talking about breast cancer today, and breast cancer is the commonest cancer in women. And with some bit of awareness about this common disease, picking up the disease at the earliest possible stages 1 and 2, and without any delay, getting the right treatment can cure the cancer in majority. We talked about a painless lump being the commonest symptom of breast cancer, and how most doctors would have to evaluate or test for disease in way of mammography, which is a specialized X-ray of the breast, and performing a needle biopsy, which gives us the critical information about what kind of disease we are dealing with. And then, depending on specific needs of an individual patient, we doctors would, a specialist doctor would chalk out a treatment plan, an individualized treatment plan for a patient to cure the patient in majority of cases. However, if the disease is picked up late in stages 3rd or 4th, then even then appropriate treatment can be done. It helps almost in all patients, though we may not be able to get 100% cure.
Right, great. And I think the best thing, I hope none of you get cancer, but if you do, I think that is not the end. You just have to think that this is it. I mean, I am going to take it, I'm going to move on ahead, and this is not even a thing. Just brush it aside. Trust your doctor, because the more you shop around, you ask an opinion, 1, 2, 3, so many people, you end up getting so confused. So trust the doctor you have chosen and just go ahead with it and kill it, as they say. So thank you so much for watching so patiently. I hope this didn't bore you too much and that you listened very intently. And if there are some questions you still wish to ask, please go ahead and put it in the comments, and I will be sure to respond. Dr. Agarwal is going to address your question and answer them. So please go ahead and do that. So bye until next time.
Bye.
Yeah, thank you so much. I didn't thank him. Thank you so much for being on this and for giving us your time. You know what? He was in the operation theatre and he just, I think, discarded his robes, put on his pink vest and arrived here.
Well, that was pretty much it. But then thank
Yeah.
you very much for
Yeah.
asking me to do what I consider one of the most important activities for me, creating awareness for breast cancer.
Yeah, absolutely. Bye.